Hello everyone, it's Satya Ashraf, student ID 16 from Group A batch 2018. Today I am going to demonstrate the surgical hand scrubbing technique. Before starting the technique, I would like to add few words. First of all, I am much obliged to Sir Pralab who has assigned me such a significant task. It's not only beneficial for my OT rotation, but it will also boost my confidence. So the question is that why we have to do scrubbing prior to surgery? The answer is so simple. Scrubbing contribution is critical. It simply reduces the incidence of wounds infection. The second one is that individual is primary source of the nosocomial infection. So as to avoid the nosocomial infection, we have to do scrubbing. And the third one, it helps us in significant reduction in the pathogen carriage. Now follow me for the hand scrubbing technique. If it's our first case of the surgery, we have to pre-wash our hands from the tip of the fingers up to the elbow, right? So moving toward our first step, that is to wash our hands vigorously from the tip of the finger up to the elbow. The second step is to apply a vigorous amount of scrub. I'm using here the ordinary one, but for a surgical point, we have to use the alcohol because alcohol has the benefit of removing all the gram-positive bacteria as well as the gram-negative bacteria and viruses also. We can also use the cyclohexadiene gluconate, that is CHG. What is the purpose of cyclohexadiene gluconate? Cyclohexadiene gluconate has a persistent action. It can give us a safety for about 6 hours. While a third thing is iodophores. What is the purpose of iodophores? Iodophore give us the rapid onset. So the characteristic of the categories of scrub is that it should have a broad spectrum, it should give us a persistent activity, persistent safety, and the third one is that it should have a rapid onset. Now I am using the water-based technique, so follow me for further process. After washing the hand vigorously, the second step is to apply the soap on the scrub, on the foam of the scrub, and it should be sterile. Although in home setup I don't have the sterile foam, so I am using the ordinary one. I will keep it here. Third step is that to pick the nail pick and remove all the dirt under the nails in the presence of running water, like this. Now the turn of the dominant hand. We have to discard it. Take the foam and make a foam like this. Now washing the area under the nails for at least 30 strokes. Same should be done on the dominant hand, like this. Now rub the hand palm to palm like this. We should not use the abrasive part for the remaining of the hand. For the remaining of the hand, we have to rotate the foam, surgical foam, and then applying this part over another remaining part of the hand like this. Palm to palm. Then interlacing our finger like this, making a cup of the fingers like this. The back of the fingers should be rubbed on the opposite side of the palm, on the opposite hand of the palm like this, and now like this. The next step is to wash the lateral aspect, the medial aspect of the thumb, the anterior aspect of the thumb, and the lateral aspect of the thumb. We have to use the foam like this for at least 10 strokes. An anterior portion, the lateral portion, same as to the other fingers, also like this. Now, coming toward the wrist part, it should be clockwise and anti-clockwise. For our convenience, we should divide our forearm into 3 sections, the first, the second, and the third. For the first section, we should do like this. With the help of, we can also do it with the help of our scrub like this. The medial portion should be rubbed like this, then the anterior portion, and the lateral portion. Now coming upward like this, and same should be done to the another hand like this. The whole process take about 2 to 3 minutes if it's performed correctly. Like this, then clockwise and anti-clockwise, and we will divide for our convenience. Once the area is clean, we should not come back to follow the same area again. Now I am done with it. We will wash the hands like this, from the tip of the fingers and the wrist portion, then the arm and up to the elbow, 2 to 3 centimeter above the elbow. Here the position of our hands will be right above the elbow, and the elbow should be at 90-degree angle. And now we will not touch anything which is unsterile. So I am done with the process.
It's time to dry my hands. The purpose of drying hands is that it has 1,000 times less risk of the nosocomial infection than that of the wet hands.
The last part is that how to close the facet. We have to close the facet with a paper towel.
Bye-bye.
Thank you for watching. If you have any queries, you can ask me in the group.